Portfolio Committee on Health is currently at Tembisa Provincial Tertiary Hospital following a damning report released by the Health Ombudsman. Now, that report found that the hospital was negligent in the death of Kgosi Letlape. You remember Letlape died from COVID-19 related complications at that institution back in June last year. Joining us now is Dr. Kgosi Letlape. He is the former president of the Health Professional Council of South Africa to help us better place these developments. Doc, thanks for your time and welcome to the program, spending your Saturday morning as one should. But let me ask, what concerns, if any, you have about the possible chilling effects this report might have, specifically on doctors working in the public health sector?
I think the biggest concern is it highlights a system failure, that our health system is failing the public, and practitioners also, we need to up our game in terms of where we work. This is really a significant system failure. For a patient not to eat for that long a period, it means nobody was even aware that the patient is still in hospital. And hopefully the matter will be fully investigated so that corrective measures can be taken. And if there's any issues of professional negligence, the relevant authorities will deal with that.
It begs the question then about in what scenario doctors can be held responsible in their personal capacities for a loss of life that takes place in a context where there's a systemic failure on the whole.
I think if we don't want this to recur, we need to fix the system rather than blame individuals that work in a system. We've always been concerned, or I've always been concerned about an unsuitable working environment, whether a working environment is not conducive to you upholding proper ethical behavior. I'm not trying to find an excuse for practitioners. Where practitioners are found to be negligent, they should be held accountable. But how does a patient go for days without being attended to? How do people not see that the patient is missing? This is a severe systemic failure. And I hope the responsibility will not just be the individual practitioners being held accountable. The system should be held accountable. The administration should be held accountable. The provincial authorities should be held accountable. The ministry should assure the public. How are they going to ensure that this doesn't happen again?
What's interesting to note is that, the CEO of Tembisa Hospital himself, Dr. Mokhaladi, who himself is a medical doctor, is now facing growing calls for him to step aside. He's announced on the record that he's willing to take this report on review, but then the health department came forward to say that they're actually not going to challenge the findings. Do you think the health department is approaching this correctly?
I think we just need to be careful that the health department, because no finger has been pointed at the department. So the department would have no reason to want a review because they are getting off scot-free. And we should be asking the Ombudsman, what is the responsibility of the health department? What is the responsibility of the Ministry of Health?
Well, to be fair...
And I guess everyone has legal recourse.
Yeah.
Everyone has legal recourse in our system. Everyone should account. The practitioners should account. The CEO should account. The MEC should account. The Premier should account. The South African health system should account. And the authorities that are responsible for the system. All of us should account.
To be fair, the report did mention that the former MEC of Health, Dr. Bandile Masuku, should also be held responsible for even pointing out Tembisa Hospital as an institution that's ready to cater for COVID-19 patients. But what also came out of this report by Professor Malekapuru Makgoba is a recommendation for an independent forensic firm to move into the institution and try to ascertain whether the leaders of the hospital are fit for purpose. What questions do you think this firm should be asking?
Well, I hope the system, we should stop creating casualties of individuals and hold the total system to account. We have an under-resourced hospital that's serving a huge area. Those things need to be looked into. Experts are saying that area needs hospitals, 2 hospitals the size of Tembisa Hospital. All those matters should be taken into account. It is about time that we fix our health system and we start sacrificing individual professionals. Let us collectively, as South Africans, build a health system that all of us would be proud of, so that any of us should be happy to go to Tembisa Hospital for our care.
With that in mind then, Doc, at which stage do we say that a doctor has failed to adhere to the tenets of the Hippocratic Oath?
That is a matter that can be, a complaint should be lodged, and it should be lodged with the HPCSA, and peers will look at the matter and come up with a finding, as the Ombud has recommended.
All right, thanks very much for your take. I certainly get a sense that this is one moment that's going to spark all kinds of conversations. Hopefully will move us to where we need to be insofar as the system, as you're emphasizing, is concerned. Former President of the Health Professionals Council of South Africa, Dr. Kgosi Letlape, thanks very much indeed.